Well, thank you all for coming, and I certainly want to thank Senator Rubio and Congressman Ron DeSantis for joining me here. The reason I decided to file this bill today, and actually gave notice on it Friday, was the fact that we now know that more than 2 million Americans have received notice of cancellation of their insurance policies despite President Obama's assurances. And in particular, in the state of Wisconsin, our office has received a number of calls from constituents really concerned about the fact that the health care that they liked, that they chose, is no longer going to be available to them. And in particular, there was a couple in Wisconsin, both cancer victims. The wife of this couple has stage 4 lung cancer. Her husband is recovering from prostate cancer. But they were part of the Wisconsin high-risk insurance pool. It's a plan that works. As an employer, certainly we would have people that worked for me that I covered with insurance that would have a health problem, then they'd get lasered out of our policy, and they would avail themselves of that high-risk pool. It really worked. But now because of Obamacare, those high-risk pools are extinct. But this couple called our office because they got that cancellation notice, and they could not get onto healthcare.gov. Tried over 40 times. And now, let's face it, when you have cancer, adding stress to your life is not a very good thing for you. So we tried helping them as much as we could. They've contacted a couple different insurance carriers. They're getting some preliminary quotes. And the sad fact of the matter is, under the high-risk pool, their total exposure would have been about $20,000. It was an amount of coverage. It was an amount of exposure they could handle. But initial quotes is going to double that. Now their exposure looks like it would be close to $40,000. And they don't know how much subsidy they're really going to qualify for. So what we're finding is that the promises that President Obama made, I always call them the two big ones. First of all, President Obama said that if he passes health care law by the end of his first term, the cost of a family plan will decline by $2,500 per family. That's not true. That's a broken promise. But the other really big promise was probably best stated in his June 15th, 2009 quote. He said, "If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan, period. No one will take it away, no matter what." He made that statement in front of the American Medical Association. That's what he told the American people. Now, one of two things is true here. Either President Obama was being dishonest, or he was disengaged once again. He either was dishonest or didn't have a clue what was in his own bill, or didn't understand the consequences of his own health care law. That's pretty sad commentary on his leadership. So today, I filed a bill, If you like your health plan, you can keep it act, and it's pretty simple. It's actually a true grandfather clause. You know, in the Patient Protection Affordable Care Act, there is a grandfather clause, but it's a phony grandfather clause. We make it a real grandfather clause, basically using the exact same language. We just remove from that grandfather clause the exceptions, the mandates that make it a phony grandfather clause. And so I'm certainly calling on all of our colleagues in the House and the Senate to get behind this bill so that President Obama's promise can be honored to millions of Americans. Now, unfortunately, that couple I talked about earlier, this bill can't help them. The only way we can keep that promise that President Obama made to every American is through full repeal of the health care law. But at least if we pass this bill, the sooner the better, that promise can be honored to millions of Americans. So with that, I'd like to turn it over to Congressman DeSantis, who is offering the companion bill in the House, for some comments.